I love this organization. It gives women a voice, actual women patients.
Women come from all ages and all walks of life. We are here for women for their first gynecological exam, young teenagers all the way to postmenopausal women.
I believe our mission is to serve women with as much dignity and respect and honor of their place and their position, their lot in life, their current experience, where they're going, what their goals are.
One of the many great things about the Feminist Women's Health Center is the fact that it most definitely brings in that diverse ideology and those diverse women and people who believe in the fact that all people should be treated equally and all people should be regarded in the same light.
The programs that the Feminist Women's Health Center offers are based on a concept of really broadly defining choice. We work from preventing pregnancy, educating people about how pregnancy occurs and how to have safe sex, to terminating an unwanted pregnancy.
Good prenatal care and access to birth control, access to emergency contraception, having healthy families, the timing and spacing of your families, all of those things that encompass reproductive justice.
There are other organizations that do legislative work, that do advocacy work, but they don't work directly with women. So the Feminist Women's Health Center has the unique perspective of both treating patients and doing legislative and other types of advocacy.
Once I got here and found out all the different things they do for women, I was just amazed, and I really want to work here.
One of the things that we've done, which you rarely see in Atlanta or even the Southeast, is reach out to Hispanic women, reach out to people of other cultures that haven't yet assimilated to the United States of America. So you get immigrant women, you get Hispanic women who are American citizens but nonetheless don't speak English very well. And we find that a lot of these women have never even been in the healthcare system at all, which is kind of stunning considering that some of them are mothers of 3, 4 children at that time.
There was a caller that I had been talking to before a lot, and we had developed like a certain trust over the phone. And I remember one day she calls me up and she's like in really lots of distress and very worried and concerned about her situation because I believe she was having a miscarriage. She didn't have anyone else to call. She was a recent immigrant, afraid to go seek services somewhere else. And even if she went to seek services somewhere else, she didn't have an interpreter or translator with her. She only spoke Spanish, and her husband only spoke Spanish. And she also didn't have very much money. And so in her case, it was really difficult for her to find someone else or somewhere else to go. And so even just by talking to her over the phone and giving her the information she needed and calming her down and helping her through that situation, and then later giving her help here, she ended up being okay.
They have a whole program of sensitivity care, so sensitivity for someone who's survived violence or rape. They also have lesbian sensitive care, and so a lot of people who have come through these doors wouldn't have been served at least as well in any other environment that I know of.
My department is reproductive services. What that means is it's primarily a fertility program. I work with clients and couples who are seeking to get pregnant, some of who have been trying to get pregnant and are having challenges and need some medical intervention of some kind, or at least just some assessment.
We see a mixture of patient types ranging from lesbian couples who are wanting to start their family, to single women who feel like their biological clock is ticking too loudly, to couples where there's a known male factor and they're wanting to use donor sperm to get pregnant. So we see a little bit of everything.
Well, I have this running joke about my own experience. I always say that I'm not just the president, I'm also a client. And What I mean by that is that I was able to get pregnant through our services here, and that was a challenge. I was one of those clients that needed that doctor diagnostic management.
I do believe that if you want to have a child, you should be able to have, irregardless of anything else. If you have the means and the desire, then that is your right, just as it is your right to make a decision not to have a child.
I got involved about 13 years ago, right after the birth of my daughter, and I wanted to work in women's issues, and I wanted to be able to preserve the right for her when she got older, preserve the right to access reproductive freedom. And I'm sort of at the tail end of a generation where I always had reproductive freedom, but that which is the way the country is moving, it looks as though that may not be the case for the future. So a young woman like her, I want to be able to maintain that choice for her.
The Young Women's Leadership Project is designed to empower young women and give them the skills and the leadership capabilities that they need in order to go on and to do this work and to really work in the movement later on. We have seen the very tangible results of the Young Women's Leadership Project, of women learning these skills around lobbying, around fundraising, around grassroots organizing. We've had over 1,900 young women that have gone through the Young Women's Leadership Project. It's designed to infiltrate into the community so that women's health and women's lives are better everywhere, not just here with the people that come to our center, but for women everywhere across the country and across the world.
There's just been a huge shift away from women's freedom of choice with all sorts of restrictions, not just on abortion, because that's really only a piece of it. It's much bigger than that. Access to contraception. I mean, when we get to a place where a pharmacy can decide and choose not to sell emergency contraceptives, and that limits access to a method for a woman relying on a condom, that restricts her access, and that shouldn't be. I mean, if we allow males to have access to prescriptions unrestricted, then it should be so for women.
Feminist Women's Health Center is here to fight the fight, and we don't fight it alone. Every place that we think we can be, we try to be, to get the word out about here's what rights we could be just taking for granted right now. Let's not do that. Let's really prize and treasure these things, and let's make sure that they're in place for our next generations.
It does feel like a David and Goliath battle, but I think in the end David won, and I think you have to just keep pushing forward, and we need to keep advocating for those rights and to help people understand that this is an important issue and it's not as black and white as everyone thinks it is.
Certainly we're in the most threatening time that we've ever been in. And at the same time, I noticed that the people that I work with here and in the community are the most determined I've ever seen.
You know, it's funny, we're not really a political organization whatsoever, and we've kind of been cornered and forced into that position. More than anything else, we need those who support us to not just support us financially, you know, although that's wonderful and we certainly need it to help more women and their families, but we need them to speak up for us. You know, for these many poor women who do not have a voice, we need brave people to bring that voice for them to the forefront. You know, if we don't speak for them, who will?